FluSense, which can detect coughing and crowd size in real time, can directly monitor flu-like illnesses. Its creators, researchers at the University of Massachusetts Amherst, say this technology could be among the tools used to forecast seasonal flu and other viral respiratory outbreaks, such as the COVID-19 pandemic. I spoke with FluSense co-creator and PhD Tauhidur Rahman, an assistant professor of computer science.
What I learned is there's this giant kind of lag in data aggregation and data presentation. So if we look at the current program, we'll be able to see that it primarily relies on aggregated reports from state-level public health agencies for monitoring influenza-like illness burdens over the course of the transmission season. And these reports are essentially based on from Sentinel reporting sites, which include hospitals and selected outpatient clinics. Additionally, some virologic surveillances and testing results and reports are collected by clinical laboratories affiliated with the CDC. However, there is a substantial lag time in the reporting of the CDC data. For example, reports of outpatient visits are only available roughly about 7 to 14 days after the visit itself. And during holiday periods, this delay can be even extended. So this time lag is primarily due to the complexities of how virological testing and how hospital patient reports are handled and recorded by the CDC. And this time lag is a major threat for public health, as an epidemic event has the potential to expand and spread rapidly, which without detection during this period, which we are kind of observing right now, right?
Yeah, as we've seen with COVID-19, big changes in just a few days. And you're saying the lag time currently, sometimes with these reporting is a week to 2 weeks. That's a considerable difference. So with FluSense, the technology that you and colleagues have developed, what's the difference in that reporting?
Our current approach is that we build off-body contactless sensing systems that can capture bioclinical syndromic data directly from the crowd. So what we measure is things like sneeze and coughing instances that naturally happens in different crowded public areas. And what we do is we count these events. And what we essentially in the publication, what we have demonstrated that these events, that is cough count per person time, which is a measure of crowd density, this cough count can be essentially used to track influenza trend, and it is statistically significantly linked with statistical trends that we observe in a certain community.
So is it the frequency of the cough that the device is monitoring for? What is it about the cough that's sort of triggering the device to say, pay attention, this is data that we need to be collecting?
Cough is one of the major symptoms that actually currently. So if you look at the way CDC defines influenza-like illness syndrome for reporting purposes, you can see that it's actually a fever of 100 degrees Fahrenheit or roughly about 37.8 degrees Celsius or greater, plus sore throat and or cough. So cough and various vocalization that naturally happens. These sounds, including sneezing and coughing, are indicative of these kind of respiratory illnesses. And so what we do is we make these edge computing platforms that includes microphone array so that it can not only capture coughing instances, but also kind of can potentially give us a measure of how many people coughing in that particular area or sneezing in that particular area. And it essentially uses machine learning technique in addition to the acoustic sensing technology. So with the microphone array, it essentially captures the acoustic environment, and with the machine learning techniques, we have implemented a cough detection algorithm that can work in a highly crowded environment.
Have you tested it in a real-time environment setting?
Yes, so we have deployed the device over a period of 7 months, and we have tested it over the entire course, and we found that our cough detection technology is reasonably highly accurate. It works more than 90% of the time. And we have also analyzed over 21 million of audio snippets throughout this entire time for analyzing this data.
So where do you think that the devices should or could be used to help in these public health crises such as the one we're experiencing right now with COVID-19?
Although we have validated the data for influenza-like illness and for influenza, specifically for influenza, there potential for this device to work in the COVID-19 setting. Cough is a major indicator that we hear about, right? As the device can capture cough and sneezes, which you also have recently expanded. We have a sneeze model as well. I believe that this can really be able to capture the symptom dynamics, underlying symptom dynamics that individuals are going through. And we can really capture the underlying symptom dynamics from different crowded environments, things like classrooms, hospital waiting rooms, cafeterias, and things like that. And we can really then try to understand what's really happening and what our population is experiencing in terms of the symptoms, which is currently not being recorded. As far as I'm concerned, by the CDC.
As the paper has been published, what reaction have you received from people either in the public health community or colleagues?
Yeah, we have been fortunate to get overwhelming response. I mean, we've been working on this paper for roughly more than 2 years. Unfortunately, this is the month when the paper got published, when we were kind of going through this pandemic. But since then, we have got overwhelming support. I think we have various agencies, various organizations who are doing these open initiatives reach out to us. Different tech companies reach out to us how they could potentially scale this device up and kind of distribute it everywhere, and how we could potentially collect data from many different regions and areas. So we're getting overwhelming response.
And what are the next steps now that you've had this response?
So the next step would be for us to open source some of our data. So we have received numerous requests for sharing some of our cough data sets. We are also planning to continually work on improvement of our sensing capabilities. Thermal camera is also something that we also have on the device. We actually right now use thermal camera to count people or get a rough estimate of crowd density. Another large direction that we are trying to pursue is looking at cough style. So is there information in how people cough? So in the COVID-19, for example, we have heard about wet cough versus dry cough, right? So one of the indicators for COVID-19 is apparently dry cough. I mean, I'm not an expert. I don't specifically hold expertise in this. So now what we want to do is, once we collect some more data, we want to see if we can really build a classifier that will detect specific coughing style that are more indicative of a certain kind of pandemic or epidemic.
You've talked about some of the public health ramifications for using this tool, ways you think it could help, but do people need to be concerned about privacy? You're talking about counting people in a crowd, listening in a crowd. Mm-hmm. You know, is personal private data a problem here?
That's a great question. Privacy is one of the major concerns, and we really try to make it privacy sensitive. Number one, we don't listen to people's speech. All we are really concerned about is counting cough or counting sneeze. And secondly, also with thermal camera, it's much more difficult for anyone to really detect individuals. So the tracking capability is kind of lost.